Hello, and welcome to the California Primary Care Association webcast on how to establish a mobile clinic. This webcast will cover the definition of a mobile clinic, the state of California requirements for establishing mobile clinics, what to expect once you've submitted an application for licensure, and who to contact for updates on the status of your application. The sections of law that define mobile units are linked on this slide. According to the Health and Safety Code, a mobile unit is a commercial coach that provides medical, diagnostic, and treatment services in order to help ensure the availability of quality healthcare services for patients who receive care in remote or underserved areas and for patients who need specialized types of medical care provided in a cost-effective way. Let's go over the requirements for the different types of mobile clinics, starting with mobile intermittent clinics. The type of mobile clinic application required depends on the hours of operation of the mobile unit and the length of time the overarching organization has held a valid primary care clinic license. If you are operating a mobile unit for fewer than 40 hours per week, you can establish the mobile clinic as intermittent. If operating the mobile site for more than 40 hours per week, you should apply for either an affiliate mobile clinic application or an initial mobile clinic application. Eligibility for an affiliate clinic license is based on whether the owner has held a primary care clinic license in good standing with the Department of Public Health for at least the immediately preceding 5 years. If you have not held a primary care clinic license for at least 5 years, you must submit an initial mobile clinic application. Please also note that mobile units are reimbursed at the Medi-Cal PPS rate of the licensed parent site, whether intermittent or licensed. And they must bear the Department of Housing and Community Development HCD 415 insignia, which will be covered later in the presentation. As a reminder, there is currently a waiver in place through All Facilities Letter 2030 for clinics conducting COVID-19 screening, triage, or vaccinations, allowing clinics to operate intermittent sites beyond the usual 40-hour per week maximum. The waiver is currently set to expire on June 1st, 2021, but CPCA staff expect it to be extended through August 30th, 2021. For the current version of the AFL, you can check the link on this slide. To establish an intermittent clinic, whether it is a mobile or brick and mortar site, you must notify the Centralized Applications Branch of Licensing and Certification at the California Department of Public Health. California clinics are required to notify CAB of all intermittent sites at or prior to the time of the parent clinic's license renewal. For guidance on completing the notification, you can refer to the checklist that CAB has on their website. Once CAB receives and processes the notification, they will update and reissue the parent clinic license to reflect the address of the intermittent clinic. When notifying the Centralized Applications Branch of a new intermittent site, you should include the information listed here for both the site you have selected as the parent clinic and the intermittent site itself. For the most up-to-date requirements for establishing an intermittent site, please refer to the links on the last slide. When you establish an intermittent clinic, you must also submit notification to the Provider Enrollment Division of the Department of Healthcare Services. PED will update your provider master file, or PMF, so that you can bill for services rendered at this intermittent site under the Medi-Cal PPS rate of the parent site. To ensure that you can bill for services as soon as possible, you should submit this notification as early on in the process as you can. CPCA recommends that notifications to both CAB and PED are sent at the same time and as early as possible. The notification to PED must include the HRSA notice of award if the clinic is an FQHC to show the intermittent site as part of your HRSA scope. The notification should also include a memo on corporate letterhead requesting enrollment of the intermittent site. There is a sample memo linked on this slide for your reference. For Medicare enrollment, intermittent sites must enroll directly and receive their own provider transaction access number. Next, let's go over the requirements for a primary care clinic initial mobile clinic application. To apply for an initial mobile clinic license, meaning it's not an affiliate license, you must submit an initial mobile application to the Centralized Applications Branch, which requests clinic information including but not limited to services to be provided, hours of operation, and vehicle registration. As part of the application, CAB also requires providers to submit proof of HCD 415 inspection by the Department of Housing and Community Development. As part of the application, CAB also requires providers to submit proof of HCD 415 inspection by the Department of Housing and Community Development. The HCD 415 insignia is a sticker that must be displayed on the vehicle as it signifies that it passed inspection. The insignia is valid for the life of the vehicle, so if you inherit a mobile unit that already bears the insignia, you do not need to go through the inspection. The HCD 415 insignia is required on all mobile units, regardless of clinic licensure status. So although CAB does not collect proof of the insignia for intermittent mobile clinics, the Department of Housing and Community Development still requires it. If you are applying for a mobile clinic license, proof of the HCD 415 must be included for your application to be considered complete and ready for CAB to review. Another crucial piece of the application for a mobile clinic license is approval from the Office of Statewide Health Planning and Development, or OSHPD. You must submit with your application a letter verifying whether the mobile unit is self-contained or if it has facility-provided utility connections, and documentation of approval from the local zoning authority. If local zoning authority does not require approval, submit a copy of a letter stating that approval is not required. If you are applying for an affiliate mobile clinic license, the unit will be subject to the same OSHPD requirements. Once you have submitted a complete application to CAB and they perform the review, if the documents are approved, they send the application to the local district office of licensing and certification. The district office may conduct an on-site inspection of the clinic at any reasonable time, and the inspection may include review of policies and procedures or demonstrations of a mock emergency drill. For a full list of requirements that a district office surveyor may inspect, please review Health and Safety Code Section 1765.101, linked on this slide. After the district office completes all required surveys, the application is sent to the Provider Certification Unit and then on to the Provider Enrollment Division at DHCS for enrollment into Medi-Cal PPS. For an affiliate clinic mobile license, the application documents are very similar, but a license is awarded without a need for an initial on-site survey. Through this process, existing clinics can license additional sites in a more streamlined way if they meet all the criteria. As mentioned earlier, to be eligible to apply for an affiliate mobile clinic license, a primary care clinic must hold a valid, unrevoked, and unsuspended license for at least the immediately preceding 5 years. The clinic applying to add the site must not have a history of repeated or uncorrected violations that pose immediate jeopardy to the patient. The original clinic, sometimes referred to as the parent clinic, and the affiliate clinic must have the same corporate officers and board of directors and be operated by the same organization. The affiliate clinic must also comply with minimum building standards. An application for an affiliate mobile clinic should include a cover letter stating that the original parent clinic meets the criteria mentioned in the last slide. For more detailed instructions, the application packet and application checklist for an affiliate mobile clinic, please visit the Licensing and Certification Division's website, linked here. Moving on to what to expect once you submit your application, the Health and Safety Code states that CAB has 30 days to review and approve an affiliate application if the application is complete upon initial submission. If the application is not approved, CAB must notify the clinic within 30 days of the reason for denial. As explained earlier, CAB then sends the application to the local district office. When the application reaches the district office level, the DO must issue a license to the clinic within 7 days. The district office forwards the certification forms to PCU and then to Provider Enrollment. The Provider Enrollment Division will notify the affiliate clinic of its enrollment in Medi-Cal which will be retroactive to the date of certification. The process is the same for an initial mobile clinic application, except that CAB has 100 days to review and approve the application, and the district office will do an initial on-site survey. If an affiliate clinic application is submitted and is deemed incorrect or incomplete, CAB is not required to meet the 30-day timeframe, but is held to the initial 100-day timeline instead. Once you've submitted your application, you can connect with CDPH and DHCS to check your application status. The centralized application branch uses a general email box for status update requests, and the provider enrollment division has a new online inquiry form for provider requests. Both the email address and inquiry form are linked here. For questions on the application process or delays in application review, please email lgrant@egrant@cpca.org. Thank you.